been a really rewarding, inspirational and motivating experience. So as a group, it's really brought us together and focused our minds on the things that we really want to work on to improve the quality of the care that we provide, and as a result, improve the outcomes for the children that we look after. And as a byproduct, it's made us feel more satisfied and more engaged, and actually we're just working better together as a team. So all in all, it's just been a really outstanding experience.
For us as a team, it's been a very impressive learning journey. We've learned a lot. We've learned a lot of new techniques. We've learned a lot about sort of translating our ideas into concrete developments, I think that's the key thing.
I think having the time to come together as a team and to be able to spend that time with a really focused process has been really valuable.
And also to understand that we have to be saying the same things all the time, getting that consistency and consistent message to our patients.
The main benefits of participating in a collaborative are that it brings teams together, but also brings teams together in a space where they learn new techniques and approaches, and they also share the learning and sometimes what hasn't worked with each other, and gain more sort of confidence and courage to make the changes that perhaps they've been thinking about for some time, but that they also see the benefits of through their working and sharing with partners across a much wider geography than they'd be working in normally. The teams themselves have learnt several valuable ways of approaching complex problems, that they've chosen something that they were really passionate about, created a shared purpose, often with teams and others outside their direct clinic arrangement, and that they have taken soundings from patients and from staff, and they put these into practice. And what we've already seen is results, not just in how they feel the work is going, but in feedback from patients and family members, but also in the very important parameters that we're also measuring through the national audit around the measures around control of their diabetic care, their involvement in diabetic care and self-care, and their confidence in being able to look after themselves outside of the medical environment, which is so important for children and young people with diabetes. We can really help teams grow, mature and become much more high-performing in their approaches to difficult situations and to change. And secondly, that we can get really significant impacts in quite a short period of time when we focus on that, plus give people the opportunity to use quality improvement methods in that work. I think what we can see today in our listening to where the projects have got to already, and still people are sharing ideas, adapting ideas, taking them back to their own environment, and I'm sure that this is just the beginning of many months and years of continuous improvement in the care that these teams are going to deliver for patients and young parents, patients with diabetes and their young people with diabetes.
The main things that we have got out of this project is to involve patients in their care, be patient-focused, and to continuously improve and learn in this journey of us improving diabetes care for our patients.
It's been a really sort of positive experience for us doing the QI project, and I think what's really nice is it's made every team member in the group have a voice, and I think overall the QI project's been quite uplifting for the team. It's meant that we've worked more cohesively together and everyone's feeling more inspired after doing it as well.
Well, it has been quite a journey. We have, as a team, worked very hard and come up with lots of really good ideas, which for once we've put into practice and made some real change to the benefit of our patients. We're very proud of what we've done and looking forward to carrying on the process moving forward.